The health threats facing teens today are different than when you were in high school. Here's what you should look for. Hi, I'm Carly Stern, and I'm not a doctor, but I know one. Let's go ask an expert. So I think a lot of parents think, I was a teen once, I know what my kid is dealing with, but are there new health challenges that are facing teens today?
There are. So we're seeing a lot of prevalence of caffeine products on the counters. Those include caffeine within energy drinks, gum that also is containing high levels of caffeine, and powders as well.
But a lot of us have coffee in the morning, so why is this a bad thing?
So children are actually much more sensitive to the effects of caffeine. We see that their bodies are more naive to it, and in turn, they can have real serious side effects that include an elevated heart rate, high blood pressure, nervousness, and dehydration.
What about more serious drugs?
The more serious drugs that are out there include THC. We're also seeing a lot of nicotine pouches that are readily available in simple bodegas and grocery stores, and children have access to all of these. So it's really important to be mindful of the exposure that your kids are having, and also ensuring that we're asking questions of them.
Why do we need to worry about nicotine pouches if they're not smoking cigarettes?
So nicotine is a highly addictive substance. We know that it dysregulates the dopamine within our bodies, and we become highly addicted to it very quickly. So this is changing the neurochemistry within our brains. And for children during their early phases of development, it's actually really critical to ensure that they're not having exposure to these harmful chemicals.
So it's worse for teens than it is for adults?
It's worse for teens than it is for adults because it actually changes their neurochemistry in a very important developmental phase of their brain growth.
So what should parents be on the lookout for?
So I think some signs and symptoms of of substance abuse really in teens include irritability, moodiness, an increased amount of sleep. We also notice some nausea sometimes. And the signs and symptoms can just be like this general kind of sense that our kids are cognitively off. Maybe a little bit of brain fog and confusion.
If you want to learn more, go to NYU Langone Health Online to find an expert.